Hey there, I am Ron Galloway. I'm speaking today at the Critical Issues Summit in Wichita, Kansas. Very pleased to be here. And what I'm going to talk about today is actually something that's sort of come out of the blue for hospital systems in the last few years. Two things, really. One is people getting into healthcare that weren't in healthcare before. For instance, Walmart. Walmart was not in healthcare before, but now, well, I'll go ahead and preface this by saying 5,000 people a day go into a Walmart, and Walmart noticed that. And Walmart's like, we can build other things for them, and they did. And now they're building out Walmart healthcare centers. They've shown success in it before because of the $4 Walmart healthcare plan, which everybody copied. CVS is really building up their primary care facilities. CVS has 10,000 locations at about 1,500 minute clinics, which means many of them in Kansas, which means that takes bodies away from your ordinary hospital. The other thing that's coming into it, though, which I find interesting, is that hospitals are now becoming data centers. You almost have to think like a data professional, like a Facebook or like a Google, when you're at a hospital now, because since the advent of electronic healthcare records, and I believe they were mandated in 2009, everything's on record. You're mandated to have everything on record, but now people are using that data for things. For instance, you can tell now that when a person comes into the ER, you can use artificial intelligence to basically tell how long they're going to need to be in the ER. So lots of things that we are seeing coming on now that we would have not expected at all are about to affect healthcare. It's a little bit like this ChatGPT thing that everybody's been hearing about lately, where all the kids are using it to type their term papers. Essentially, there's ChatGPT type procedures coming to healthcare. And the people who are proficient at healthcare are going to use that to nuzzle their way in, like Amazon, like Google, like Apple, but especially Amazon. Amazon's already doing prescriptions. Amazon just started doing a telemedicine service where you can phone in and get help. So there's really competition coming from two directions for y'all. One is traditional retail outlets, which are used to having bodies, and the other is data outlets, which know how to handle the data. So y'all are going to have to learn, I believe, to be proficient in both areas, pay attention to both areas, and learn the terminology, learn the lexicon of data, because really healthcare is all about data now. I'll give you an example. All the data on Facebook, people give it voluntarily, and Facebook is worth, let's say, $500 billion. But they don't scrub that data. We don't know if that data is real. People have fake names. We know all the EHR data is real. How much is that data worth per person? A lot. And that's why everybody is interested in it right now. Apple, for instance, has said that 10 years from now, they're not going to be remembered as an iPhone company. They're going to be remembered as a healthcare company. That's how serious the data people are taking this. So I would encourage y'all to learn a little bit about the data area and pay attention to the Walmarts and the CVSs. Those are the big two we have to pay attention to as they make further strides in this area. I'm happy that you've allowed me to talk to you. Thank you very much for your time and listening to me, and I hope you have a great rest of the day.